USMLE style question. A 58-year-old man is brought to the clinic by his wife due to increasingly inappropriate social behavior over the past 2 years. He has become impulsive, makes rude comments in public, and has developed a lack of empathy for others. He has also shown compulsive behaviors such as repetitive hand movements and excessive eating. His wife reports that he was previously well-mannered and responsible, but has lost interest in work and hobbies. On examination, he has no motor deficits, but shows poor insight and judgment. MRI of the brain reveals atrophy of the frontal and temporal lobes. Which of the following pathologic findings is most characteristic of this patient's condition? A. Neurofibrillary tangles and beta amyloid plaques in the gray matter. B. Alpha-synuclein inclusions in the substantia nigra. Tau protein inclusions and TDP43 positive inclusions. D. Multiple infarcts involving the deep brain structures. White matter demyelination with perivenular inflammation. Answer and explanation. Correct answer, C. Tau protein inclusions and TDP43 positive inclusions. This patient presents with frontotemporal dementia, FTD, also known as PIC disease, which is characterized by early personality and behavioral changes, disinhibition, apathy, impulsivity, executive dysfunction, poor planning, judgment, language impairment, if left temporal involvement, frontal and temporal lobe atrophy on MRI. Pathologic features of FTD: PIC bodies, round, intracellular tau protein inclusions, TDP43 positive inclusions, seen in some subtypes, marked atrophy of the frontal and temporal lobes. Incorrect answers: A. Neurofibrillary tangles and beta amyloid plaques in the gray matter. Alzheimer disease, which presents with progressive memory loss rather than early personality changes. B. Alpha-synuclein inclusions in the substantia nigra, seen in Parkinson's disease and Lewy body dementia, which presents with Parkinsonian features, fluctuating cognition, and visual hallucinations. D. Multiple infarcts involving the deep brain structures, suggests vascular dementia, which presents with stepwise cognitive decline and focal neurologic deficits, rather than behavioral disinhibition. E. White matter demyelination with perivenular inflammation, seen in multiple sclerosis, MS, which presents with relapsing remitting sensory, motor, and cerebellar deficits, rather than personality changes. Key learning points: frontotemporal dementia, FTD PIC disease, early behavioral changes, disinhibition, apathy, impulsivity, executive dysfunction, poor planning, loss of insight, can also present with primary progressive aphasia, language impairment. MRI findings: frontal and temporal lobe atrophy, pathology, PIC bodies, tau protein inclusions, TDP43 positive inclusions. Contrast with Alzheimer disease, FTD affects behavior and executive function first. Alzheimer disease presents with memory loss first. Would you like another question on